the concept of offering financing to every patient starts with these basics. What is the purpose of this? Well, it's to help people say yes to your recommendations, accept the treatment. It helps provide more value. Patients might be able to do more now that they have access to financing options. And like I was saying earlier, even if people have the ability to pay in full, they may prefer to hold on to that cash and instead use an alternative payment method. Your financing options are not just for today. They're for future treatments too. You have the ability to use a lot of the tools to help nurture the relationships, follow-up, and future scheduling with your patients. And I recommend strongly to reach out to your financing vendors. Find out what marketing tools are in the toolbox. What can you leverage to really help people know what their options are and generate awareness in a thoughtful way? Don't wait for an objection, because now it's getting really awkward. And this is what makes it tough for a lot of folks. Oh, I feel like I'm pushing financing. And it's like, yeah, because you're waiting until they told you no. And now you're presenting financing options? That seems like a used car sales tactic, and I don't like it. This is care. This is dental treatment. I don't care how they pay. What matters is that they get the treatment done. They maintain compliance. They stay healthy. That's what matters. Let's look at checking in. This is a good opportunity to plant the seeds with folks. So as they're checking in, maybe you're gathering some information, and you can just let folks know as a casual aside, by the way, we do have different payment options to help you split any out-of-pocket expenses today. And if that's something you're interested in learning more about, just let us know. Nice and simple, because a lot of the information you're using for insurance verification can also be used for pre-qualification. So for your financing options that have pre-qualification, this is a really great opportunity. And if it's something that the patient can review on their own device, even when they go sit back down and wait for their appointment, they can actually peruse further. So if you're talking to patients, let them know, hey, by the way, we do have options for out-of-pocket expenses. I'd love to, share it with you in case you want to read more. In my opinion, and arguably a lot of people agree, this is one of the most impactful times to say something. But in this moment, if we've done our due diligence and we generated awareness up until now, it's less of a sticker shock for the patient. It's less for you to have to explain, because you can easily point to something they've already been made aware of as a thoughtful reminder. Based on the exam, the doctor is recommending this, that, and the other. And by the way, you don't have to pay for all of that today, because we have the ability to split this up for you. In fact, if you're interested, I can show you how it works. And that's it. I'm not pushing anything. I'm just simply highlighting an option and seeing if that's of interest. What happens if they're asking for discounts? Yeah, that happens. That can be awkward to handle, especially if you don't do any discounts. You don't want to say no. We want to help people. So keep it positive. You have options to split up the bill. So focus on what you can do. You may often find that financing can often be used for minor treatments too, especially when you think about things like merchandise and at-home care products. A lot of the things that can be added on, these are opportunities. Things that, especially for some of these products that could be procured elsewhere or by other means. But with you being able to bundle it with existing treatment or bills, especially for any financing options you may be leveraging or utilizing in the moment or during that appointment, could go a really long way in not only helping with retention and patient satisfaction, but with ultimately production. Now, Johnny Smile, what's very interesting about him is that although he has some pending treatment for aligners, he hasn't said yes to doing aligners yet. Oh boy, Johnny is the perfect patient. He says yes to everything. He is always on time. He is never late. An absolute joy to have. Oh, and he always pays in cash, never has any issues paying the bill. And on top of that, he maintains his oral health. He is a model patient. So Johnny comes back 6 months later. What changed? Well, as usual, Johnny's on time. That's why we love Johnny. And this time he was offered monthly payment options. By the way, you don't have to pay for everything all at once. By the way, you can do those aligners and we can split it up using one of our financing options. And wouldn't you know it, Johnny found a payment plan. It was the 36-month payment plan. He did a dollar down today and then $170 a month. And wouldn't you know it, he was grateful. He didn't have to pay for everything all at once. And the moral of the story here is that financing options are for every patient in your practice. So don't just offer it based on what your gut's telling you.